Well, thank you. I'm happy to be here presenting this important work with you all. Again, my name is Lauren Ghazal, and I'm currently an NCI postdoctoral research fellow at the University of Michigan, Ann Arbor. I did graduate from New York University in May of 2021 with my PhD, and my dissertation is the work that I'll be presenting today, which is titled Exploring Multi-Level Factors Influencing Quality of Life in Working Young Adult Cancer Survivors. So before I begin, I'd like to acknowledge the other researchers who worked with me on this pilot project grant, Dr. Victoria Von Dixon from NYU, and Dr. John Merriman from NYU, and then Dr. Sheila Santa Croce from UNC Chapel Hill. And also I'm very, very grateful for the funding provided by the pilot project's research training program of the New York, New Jersey ERC, NIOSH T42 grant. Also currently acknowledging funding I'm receiving from the National Cancer Institute as a postdoc in the T32 in cancer care delivery research. So just so we're all on the same page, a very quick background on young adult cancer survivors, which is what this study focused on. We know young adult cancer survivors are an understudied population with unique challenges and needs. And while age groupings may vary by country, I use the National Cancer Institute and American Cancer Society definitions to define young adult cancer survivors as those diagnosed between the ages of 20 to 39 years of age. And survivorship encompasses, from time of diagnosis up until end of life. Nearly 84,000 young adults are diagnosed with cancer each year in the US. And when you count adolescents, or what they term AYAs, in this group, it's around 90,000. Among some of the most common type of diagnoses found are hematologic cancers, such as the leukemias and lymphomas. And young adult survivors face increasing disparities in their oncology care, including delays in their initial diagnosis and historically having low rates of participation in clinical trials. And when studying cancer survivorship, we look at the time period in the life course that the diagnosis occurs. So this being the key transition period of young adulthood. Cancer during young adulthood occurs at the time of dramatic educational, economic, and social change. And that poses additional challenges as there may be interruptions to work in school. So this slide here is to highlight that the number of young adult cancer survivors in the United States is increasing. This figure shows incidence and mortality rates by sex for all cancers in young adults in the US from 1975 to 2017. Incidence is above in the lighter blue and red colors, and mortality is below in darker blue and red. And aside from this rapid increase and decrease in incidence in males in the early 1990s related to the HIV/AIDS epidemic, incidence has been increasing with slowly decreasing mortality. And so the takeaway from this slide is that while more young adults are being diagnosed with cancer each year, they're living longer than ever before as a result of advancements in cancer screening and therapies. But acute and long-term survivorship are riddled with challenges affecting quality of life. So my overall study was informed by both the social ecological model and life course perspective, and taken together, these perspectives explain how a significant life event, such as a cancer diagnosis during young adulthood, interacts with each level to influence quality of life. And in this study, I explored the individual levels, such as personal characteristics, microsystem level, factors related to their work and school, and mesosystem, which were the interactions between these levels. And I used Bronfenbrenner's social ecological model to structure my literature review, looking at influences on quality of life in young adult cancer survivors from multiple levels. So we know that young adults with cancer overall have poorer quality of life than their age peers in the general population. At the individual level, young adult cancer survivors often experience higher levels of anxiety, depressive symptoms, distress and fatigue, poorer workability, and poorer financial health than their age peers in the general population. Microsystem level factors include work and education and areas of support. Work has been shown to enhance overall quality of life in young adult cancer survivors, as it provides not just financial necessities, which we know like income, but also meaning to one's life and a significant source of social support. And mesosystem level factors surround the impact of cancer on young adult trajectory of work and career. So a majority of young adult cancer survivors are in work or in school at the time of their diagnosis. However, many report a negative impact of cancer on their ability to work and are more likely to stop working or to work only part-time throughout their treatment. So I was curious into probing more in really all these levels. And this led me to discovering the concept of work-related goals, defined in the study as how a young adult cancer survivor understands why they are working and what they hope to achieve in their work. Many young adult cancer survivors have the opportunity to resume an interrupted life course and contribute to the workforce, but after a diagnosis of cancer may not be committed to the career they initially chose, ultimately impacting their quality of life. So work-related goals is inherently a multi-level concept, and the impact of cancer on work-related goals is a critical determinant of health and quality of life, particularly for young adults given their many work years ahead. So we found out that a clearer understanding was needed, especially since much of what we know were from studies on young adult survivors of childhood cancers, which was a very different phenomenon. So the overall purpose of the study was to explore the relationship of work-related goals and quality of life in young adult cancer survivors with a focus on factors influencing quality of life at the individual level and work-related factors at the microsystem and mesosystem levels. And this study used a convergent mixed methods design with equal qualitative and quantitative components. Thus, the study had a quantitative, qualitative, and integrated aim listed here. And I'll be going into these more with our findings. But first, the participants in the sample were diagnosed between the ages of 20 to 39 with either leukemia or lymphoma. Diagnosis must have been within 1 to 5 years. Participants also had to be working and or attending school to any extent at the time of diagnosis. And participants were excluded if they were currently receiving active cancer treatment and or were given a poor prognosis by their oncologists. I also used maximum variation sampling as a sampling strategy with a goal of achieving as heterogeneous a sample as possible on the following variables: sex, race, age at diagnosis, and type of work. Data collection was primarily through electronic means. Again, both quantitative and qualitative data were collected concurrently. Quantitative data included study measures collected on REDCap, and we chose instruments that are psychometrically sound and did not place too much burden on the participants. For the purposes of this presentation, I will not go into each measure in great detail, but there were 7 measures that captured study variables at the individual level, such as anxiety and depressive symptoms, and microsystem level, like job control and workplace support. A qualitative data collection consisted of semi-structured one-to-one phone interviews conducted through Zoom audio. The semi-structured format ensured consistency while allowing for in-depth narratives. And the interview guide was based on the theoretical framework guiding the study with specific questions provided and suggested probes. And we, of course, obtained informed consent. Interviews were recorded through Zoom and professionally transcribed. And participants were also given a $50 gift card as an incentive following the completion of both the quantitative and qualitative components. We used MaxQDA for the qualitative data management and analysis, which was done through directed content analysis. And again, just to show a graphical representation of the convergent design here, we collected, again, quantitative and qualitative data concurrently. Participants completed the measures and then within 2 weeks completed the audio interview. And so for data analysis, we analyzed qualitative data prior to the quantitative data, but at the same time in the study period. So I received IRB approval in April 2020 and recruited participants until July 2020. Recruitment occurred strictly through social media platforms and young adult cancer organizations. And the majority of the sample, as you'll see here, were recruited from Facebook. And as you can see, social media recruitment efforts were effective in reaching eligible participants across the US. Out of the 40 participants, 23 states were represented. So overall, our sample of 40 young adult cancer survivors was predominantly white, non-Hispanic, and female. The average age at diagnosis was 28. From a clinical perspective, most had lymphoma with time since diagnosis of 2.5 years. The sample, was educated and insured, and regarding work type, the sample fell into 3 predominant work sectors: professional or technical, healthcare, and education or research. So our findings. So regarding our first aim, which again was to describe the relationship between patient-reported individual characteristics, work-related characteristics in the microsystem, and quality of life, we have a manuscript that's in press at the Journal of Adolescent and Young Adult Oncology, which analyzes, again, this quantitative data. And we found among the 40 participants, poor quality of life was associated with higher levels of depressive symptoms, fatigue, impaired cognitive function, and poorer workability and financial health. Aim 2 was our qualitative aim, which explored symptom experiences, work-related goals, workability, self-identity, and perceived psychosocial needs in the sample. And again, this aim was actually analyzed prior to Aim 1. And we had this manuscript accepted and published in the Journal of Workplace Health and Safety, which was titled Survivor's Dilemma, Young Adult Cancer Survivors' Perspectives of Work-Related Goals. And briefly, the results of this qualitative analysis revealed the theme, which we called Survivor's Dilemma, which captured this balancing act that young adults, cancer survivors, had to pursue when they thought about the decision-making process regarding work-related goals. And it also highlighted changed perspectives on work-related fulfillment and financial obligations. So the dilemma that we found was in young adults continuously weighing their changed self-identity after the cancer diagnosis with the physical and mental demands of their work, and then this added financial impact of both forgoing current and pursuing future work. However, we don't really know where these factors actually fall on this scale. So that is what is driving their decision-making the most. And so this quote highlights the survivor's dilemma around work-related goals and the three areas of financial toxicity, perceived health and workability, and self-identity. So for example, one participant described, it's a mental thing. Your mind thinks that you need to go and do all of these things. I survived cancer. I need to go and live. But then you get done with treatment and you're like, but I have to save money. Because what if something happens? Yes, you can go and do these things. However, it almost comes with a catch. And so because of time, I'll just go through the next slides very briefly. But the first sub-theme within the survivor's dilemma was perceived health and workability around this question of, can I do this work? And then the second was self-identity. Do I want to do this work? And then the third was around that financial toxicity sub-theme of, can I afford to or not to do this work? And so the third aim was our integrated aim, which really got to the heart of that the mixed method study, which was to examine the relationship of individual and work-related characteristics to generate profiles of the work-related goals and quality of life relationship. And we have a manuscript that was just had a lengthy revise and resubmit. So fingers crossed we hear good news soon. And what we found from this third aim was that the qualitative analysis portion revealed self-assessed declines in workability that led to questioning work-related goals and influencing quality of life. And then the integrated analysis led to the development of these 4 profiles, which were really around low and high workability and then stable and unstable work-related goals, meaning did they change their work-related goals before and after their diagnosis? And again, this is just an example of the integrated matrix that has the quantitative data and the qualitative exemplar quotes that we pulled, and then this integration of what really captured these profiles. And again, because of time, I won't be going through each, but to get to our discussion, the study importantly captured the post-treatment perspectives of work-related goals among young adults who had completed treatment for hematologic cancer. And the primary finding the study suggests that young adult cancer survivors really did face this dilemma around their work-related goals. And this is consistent with existing research, but also builds on this added component of financial toxicity. And so for implications, we have for occupational health nursing practice, research, and policy, facilitating work engagement is a big thing for employers now and for HR, understanding work as an important part of young adults' social life. And then many important implications for research that I'll leave listed here. And then for policy, really getting to the heart of what is driving this financial toxicity. It's not just the increase in cancer treatment, but also the decrease in income that comes from young adults having to forego work or take a leave. And what does that mean for their future financial health? Another caveat that, we didn't really plan, but we actually had another paper published out of the secondary qualitative analysis, really on the impact of COVID on the work life of these young adults, cancer survivors, that was accepted into nursing research and is in press. And again, with limitations, we had, just very briefly, just around this third bullet, we did have heterogeneity in our type of work. and then also age at diagnosis, but with sex and race, it was a pretty homogeneous sample. And then, the limitation of the period of data collection ended up being, a plus, and we got this other manuscript out. And so in conclusion, I learned that for all young adult cancer survivors in the study, cancer diagnosis during young adulthood did drive them to re-examine their current work and work-related goals. And I discovered that this relationship between work-related goals and quality of life is complex and multifaceted. And the survivor's dilemma begins to understand this relationship. There are significant multi-level factors related to work in young adult survivors that influence quality of life. And this important and understudied population of cancer survivors continue to have complex psychosocial needs, and work is an important part that contributes to shaping their overall quality of life. This is crucial to understand as more and more young adult survivors have many work years ahead of them. And I hope to further this work by working towards clinical and policy level interventions to improve the lives of young adults that are diagnosed with cancer. So thank you again.